National Nutrition Interviews, the natural health experts, up close and personal. Introducing naturopathic Dr. Elie Klein, author of the best-selling Read This If You Have a Heart. He's a natural healthcare practitioner from Toronto and a specialist in the nutritional treatment of heart disease. Dr. Elie is the medical expert at Innotech Nutrition, the maker of ionic magnesium and CardioFlex powder, and works with them to educate consumers about the difference that nutritional supplements can make to people's lives. He's also a National Nutrition Interview guest.
My name is Elie Klein. I'm a doctor of naturopathic medicine, and I help people recover from risk factors related to cardiovascular disease, such as high blood pressure, high cholesterol, and diabetes, and I do that naturally. People need to take supplements many times because you don't get enough vitamins and minerals from the food you eat. And some of these vitamins and minerals are extremely important for your health. They make a world of difference. They can save lives, they can extend lives. So for example, vitamin D, the sunshine vitamin, you spend 20 minutes in the sun on a sunny day in the summer, and your body produces 10 to 20,000 international units over the next few days. But you get only minuscule amounts from food. So vitamin D is hugely important for the immune system, prevention of cancer, and for your bones obviously, and regulating blood pressure and cholesterol. So it's really important to supplement vitamin D. Vitamin C, for example, again, hugely important for people with cardiovascular disease, diabetes, for recovery, for helping prevent and reverse arterial plaque. Very, very important. And so you don't get enough vitamin C to do that from food. So it's really important to supplement with vitamin C when you have these conditions. These are some examples of why supplements are important. It is difficult to get enough vitamin C from food, especially when you need high amounts if you have high blood pressure, plaque in the arteries, cardiovascular disease in general, bone loss, and so on. And so you would need to eat lots and lots and lots of fruit, especially tropical fruit. And that's not very practical for the vast majority of people. And so under these conditions, it is worth your while to supplement with adequate amounts of vitamin C. The amount of vitamin C people should use each day varies from person to person based on need. And so a healthy person can probably do away with 200 to 500 milligrams of vitamin C, granted he or she are eating well, following a healthy lifestyle and diet. But someone with cardiovascular disease or risk factors for cardiovascular disease and other types of conditions would do well to take at least 1,000, if not 2,000 more milligrams of vitamin C a day. And another really important function of vitamin C, which is not very well known, is that it helps to balance cholesterol levels in the body. It actually helps slow down the production of cholesterol and increase its elimination. And so this particular study showed that you need at least 1,000 milligrams of vitamin C to achieve that. Coenzyme Q10 is a substance the body produces that participates in the production of energy in the body, energy to sustain life. So Coenzyme Q10 is important for energy production. And there's a lot of Coenzyme Q10 in your muscles. You move your muscles all the time. You need a lot of energy to move your muscles all the time. And so there's a lot of Coenzyme Q10 in your muscles. Now, your heart is your most important muscle. And so it too contains large amounts of Coenzyme Q10. When Coenzyme Q10 levels diminish in your muscles, it becomes weaker, and people may be even more prone to developing congestive heart failure. As we get older, the body produces less and less Coenzyme Q10, and we get very little Coenzyme Q10 from our diet. CardioFlex contains the kind of vitamins and minerals that facilitate the repair of the arteries and the removal of plaque from the arteries. Cardiovascular disease is predominantly a disease of narrowing and hardening of the arteries. 90% of cardiovascular disease basically manifests itself in the form of atherosclerosis, plaque in the arteries. And so CardioFlex constitutes insurance against blocked arteries. CardioFlex contains, in addition to vitamin C, CardioFlex contains high amounts of lysine and proline, which are also extremely important and are needed for the production of collagen and the repair of the arteries. Vitamin C is an antioxidant, so is vitamin E and selenium. Also has coenzyme Q10, has some electrolytes such as magnesium and potassium, which are also very important for the heart. Anybody with risk factors for cardiovascular disease, anybody with high blood pressure, where the high blood pressure is caused by narrowing and hardening of the arteries, which is the case with most people, say over 50 or 60, should use CardioFlex. So people with high blood pressure, plaque in the arteries, other forms of cardiovascular disease where you're looking to strengthen the heart, and other than cardiovascular disease, also people are looking to recover quickly from surgery, perhaps would do well to use CardioFlex, and people with chronic muscle inflammation, where production of collagen is required, would do well to use CardioFlex as well. CardioFlex is absolutely safe, doesn't interact with other medications, and as long as you can tolerate vitamin C well, CardioFlex will be safe for you. So people who follow a healthy diet can do away with 1 scoop containing 2,000 milligrams of vitamin C, so 1 scoop per day should be enough. You'll probably get more mileage from that scoop if you use half a scoop twice a day. But people with real symptoms of cardiovascular disease, high blood pressure, poor circulation, chest pain, angina pain, and so on, should take at least 2 scoops of CardioFlex a day. In addition to its ability to help improve cardiovascular disease, because CardioFlex is so good at improving collagen production in the body and reducing inflammation and facilitating repair, weekend warriors and people who work out, endurance athletes and so on, would certainly benefit from CardioFlex. When a person works out, tendons and ligaments get stretched. There's collagen membranes that surrounds muscle fibers as well, and that gets stretched as well. And so repairing collagen in tendons, ligaments, and between muscles can help expedite recovery.